Many heart problems do not begin with dramatic pain, but with slow and silent changes inside the arteries that develop gradually over many years. Across the United States, a heart attack occurs roughly every 40 seconds, according to national cardiovascular statistics from the Centers for Disease Control and Prevention. What makes this number more concerning is that high cholesterol often builds quietly in the background long before symptoms appear clearly enough to cause concern. For many adults over 60, the first warning sign is not pain, but subtle fatigue, heaviness in the chest, slower walking speed, or breathlessness during activities that once felt easy. This video is not medical treatment, and it does not replace advice from your doctor or healthcare provider. Instead, this health information channel reviews research findings and nutritional strategies that may support cardiovascular health when used responsibly and consistently. Today, we will examine 6 drinks that have been studied for their potential influence on cholesterol balance, vascular function, and inflammation markers related to heart health. Some of these drinks are simple household ingredients that many people already have in their kitchen, but may not be using effectively. Others are widely recommended online, yet often misunderstood, especially regarding timing, preparation, and interactions with medications commonly used by older adults. By the end of this discussion, you will understand why certain beverages appear helpful in research and why others provide only modest support for cholesterol management. Most importantly, you will learn how small daily habits can complement a heart-healthy lifestyle without promising unrealistic or instant results. Many people reach their 60s believing they have followed reasonable dietary advice, yet still struggle with cholesterol numbers that seem stubbornly resistant to improvement. Part of this challenge relates to the way the body processes cholesterol differently with age, particularly in the liver and the inner lining of blood vessels. After middle age, the liver may become slightly less efficient at clearing LDL cholesterol from the bloodstream compared with earlier decades of life. At the same time, the inner lining of arteries called the endothelium may gradually lose some of its flexibility and protective capacity. The endothelium acts like a smooth biological coating inside every blood vessel, helping blood flow remain steady and controlled. When that lining becomes irritated or inflamed, cholesterol particles can accumulate more easily along vessel walls over long periods of time. These changes are not inevitable or irreversible, but they help explain why cholesterol management may require multiple supportive habits rather than a single quick fix. Nutrition, physical activity, sleep quality, stress management, and appropriate medical treatment all play important roles in protecting cardiovascular health later in life. The beverages discussed in this video should therefore be viewed as supportive lifestyle tools rather than replacements for professional medical care. Researchers studying cardiovascular health often focus on a molecule called nitric oxide, which plays a central role in how blood vessels relax and expand. Nitric oxide is produced naturally in the body and acts as a signal that encourages the muscles surrounding blood vessels to loosen slightly. When blood vessels relax, circulation can improve and blood pressure may be easier for the body to regulate. Some foods and drinks contain compounds that indirectly support nitric oxide production or protect the delicate endothelial lining of arteries. These compounds include dietary nitrates, polyphenols, antioxidants, and certain vitamins found naturally in fruits, herbs, teas, and spices. However, the effectiveness of these compounds depends heavily on how they are prepared, how often they are consumed, and whether the individual has underlying medical conditions. For this reason, we will review each beverage carefully, including potential benefits, realistic expectations, and important precautions. The beverages included in this list were selected based on 3 practical considerations relevant to adults over 60. First, there must be at least some clinical or nutritional research suggesting possible cardiovascular or cholesterol-related benefits. Second, the ingredients should be relatively accessible and affordable for most households, rather than rare supplements or expensive specialty products. Third, the drinks should be reasonably simple to prepare so that they can become consistent daily habits if someone chooses to include them in their routine. These beverages are ranked from the most modest supportive evidence to those with stronger research interest in metabolic and cardiovascular studies. Keep in mind that no drink alone can reverse arterial disease or replace medications prescribed by a physician. The goal is to understand which options might provide supportive nutritional value within a balanced lifestyle. 6. Psyllium husk water. Psyllium husk is a soluble fiber derived from the seeds of the Plantago ovata plant and has been widely studied for digestive and cholesterol-related effects. When psyllium fiber mixes with water in the digestive system, it forms a thick gel that can bind bile acids produced from cholesterol in the liver. Because bile acids are partially removed through digestion, the body may draw additional cholesterol from the bloodstream to replace them. A review published in the American Journal of Clinical Nutrition reported that daily psyllium intake can reduce LDL cholesterol by approximately 7% in some individuals. While this reduction may appear modest, soluble fiber is often considered a foundational step in cholesterol-friendly dietary patterns. For older adults, psyllium can also support digestive regularity, which is another important aspect of overall health. However, psyllium must be consumed with sufficient water to avoid bloating or constipation. It is also important to take medications at least 2 hours apart from psyllium fiber because it can reduce absorption of certain drugs. In practical terms, psyllium works best as a supportive foundation rather than a dramatic standalone intervention. 5. Pomegranate and beet blend. Pomegranate juice contains polyphenols and antioxidants that researchers believe may help protect LDL particles from oxidative stress. Beetroot, on the other hand, is naturally rich in dietary nitrates that can contribute to nitric oxide production under certain conditions. Several small studies have suggested that pomegranate juice may reduce markers related to LDL oxidation when consumed regularly over several months. For example, research published in Atherosclerosis reported reductions in oxidative stress markers after daily pomegranate consumption in some participants. Beetroot has also been studied for its ability to support nitric oxide pathways that influence vascular relaxation and blood pressure. Despite these promising mechanisms, the direct impact on LDL cholesterol numbers tends to be moderate rather than dramatic. Another important consideration is that beets contain oxalates, which may not be ideal for individuals with a history of kidney stones. Pomegranate juice may also interact with certain medications, including blood pressure drugs and anticoagulants. For these reasons, anyone with chronic health conditions should discuss dietary changes with their healthcare provider before regular use. 4. Hibiscus and cinnamon tea. Hibiscus tea is made from the dried calices of the Hibiscus sabdorifa plant and has attracted research attention for cardiovascular effects. The deep red color of hibiscus tea comes from anthocyanins, a group of antioxidant compounds found in many fruits and flowers. These compounds may help reduce oxidative stress and support vascular health when included as part of a balanced diet. Some clinical studies have suggested that hibiscus tea may help improve certain lipid markers or reduce blood pressure levels in specific groups. For example, a controlled study in individuals with metabolic concerns found measurable improvements in cholesterol profiles after regular hibiscus consumption. Adding cinnamon introduces additional polyphenols that may influence insulin sensitivity and metabolic regulation. Together, these ingredients create a tea that many people find both flavorful and easy to incorporate into daily routines. However, hibiscus tea may lower blood pressure slightly, so individuals already taking antihypertensive medication should monitor their response carefully. 3. Amla ginger and lemon combination. Amla, also known as Indian gooseberry, is one of the richest natural sources of vitamin C, found in traditional herbal nutrition. Researchers have studied amla extract for its potential influence on lipid metabolism and antioxidant activity. One clinical study published in the Indian Journal of Pharmacology reported improvements in cholesterol levels among participants taking amla preparations over several weeks. Ginger contributes additional compounds that have been investigated for metabolic and anti-inflammatory effects in both laboratory and nutritional studies. Lemon juice adds natural acidity and vitamin C, which may help enhance flavor and encourage consistent use. While the research surrounding these ingredients remains evolving, they have long histories and traditional dietary practices across multiple cultures. As with any concentrated mixture, individuals with sensitive stomachs should begin with small amounts and observe how their body responds. 2. Green tea with lemon. Green tea has been one of the most extensively studied beverages in relation to metabolic and cardiovascular health. The primary compounds of interest in green tea are catechins, particularly epsgalacatechin gallate, often abbreviated as EGCG. These polyphenols have been investigated for their antioxidant properties and potential influence on cholesterol metabolism. A large meta-analysis published in the American Journal of Clinical Nutrition found that green tea consumption was associated with reductions in LDL cholesterol across multiple studies. Researchers believe green tea catechins may influence cholesterol absorption and improve lipid metabolism in the liver. Adding lemon juice introduces vitamin C, which may help stabilize catechins during digestion and improve their availability in the body. However, green tea should be brewed carefully, using hot but not boiling water to preserve delicate plant compounds. Excessive intake of concentrated green tea extracts is not recommended, particularly for individuals with liver concerns. For most people, 1 to 3 cups of freshly brewed green tea per day provides a reasonable balance between benefit and safety. 1. Turmeric golden milk. Turmeric contains a natural compound called curcumin that has been widely studied for anti-inflammatory and antioxidant properties. Curcumin has attracted particular interest because chronic inflammation is believed to contribute to many cardiovascular conditions. Research in nutritional science suggests that curcumin may influence cholesterol metabolism, inflammatory markers, and endothelial function. One challenge with curcumin is that the body absorbs it poorly when consumed alone. Combining turmeric with black pepper, which contains piperine, can significantly increase curcumin bioavailability according to pharmacological research. Healthy fats such as milk, coconut milk, or small amounts of ghee may also assist absorption because curcumin dissolves better in fat. Golden turmeric milk therefore combines turmeric, black pepper, and a milk base to improve the likelihood that curcumin will be absorbed. While this beverage is widely appreciated in traditional nutrition systems, it should still be used thoughtfully and not as a substitute for prescribed treatments. For older adults, consistency is often more important than complexity when establishing supportive health habits. Rather than attempting to consume multiple beverages every day, many people find it easier to select 1 or 2 options that fit naturally into their routine. For example, a cup of green tea during the morning and a warm turmeric drink in the evening may feel manageable and pleasant. Fiber drinks such as Psyllium may be taken before meals when recommended by healthcare professionals. The key principle is gradual and sustainable integration, rather than abrupt dietary changes that become difficult to maintain. One common mistake is expecting immediate results from nutritional strategies that are designed to work gradually over weeks or months. Another mistake is relying on a single drink while ignoring broader lifestyle factors such as sleep, physical activity, and balanced meals. Some individuals also purchase highly processed commercial versions of these drinks that contain added sugar or artificial ingredients. Reading ingredient labels carefully can help avoid unnecessary additives that reduce the nutritional value of otherwise beneficial beverages. Preparation methods also matter, especially with delicate compounds such as green tea, catechins, or turmeric curcumin. Adults over 60 are more likely to take medications for blood pressure, cholesterol, blood thinning, or metabolic conditions. Because certain foods and herbs may interact with medications, it is wise to consult a healthcare professional before making major dietary changes. Individuals with kidney disease, liver conditions, digestive disorders, or a history of kidney stones should exercise additional caution. The safest approach is to treat these drinks as supportive nutrition rather than therapeutic treatment. Cardiovascular health rarely depends on a single ingredient or trend, but instead reflects decades of lifestyle patterns and daily choices. Simple habits such as walking regularly, eating whole foods, managing stress, and maintaining social connections are equally important for healthy aging. When beverages like those discussed today are used thoughtfully, they can complement these habits by providing valuable nutrients and antioxidants. The most meaningful improvements usually come from consistent routines practiced over time, rather than short bursts of enthusiasm. By focusing on steady progress and informed choices, adults over 60 can continue supporting their heart health while enjoying a fulfilling and active life.